One of the things that we want children to be able to do is be able to attach well to the people around them. We want them to relate well to the people around them and be able to develop positive relationships with each other. And people like Mary Ainsworth, John Bowlby, talk about strategies that we can, as parents, engage in that help parents and children relate more effectively. So what I encourage you to do is start by reviewing the video of Isidore Ruckel, who grew up in a Romanian orphanage. He's pretty clear about some of the impacts of such an orphanage. And if you have not seen anything about Romanian orphanages in the past, just the orphanage is probably traumatizing, in terms of the amount of pervasive neglect. So one of the things that we often see with such pervasive neglect is a disorder called reactive attachment disorder, where we're seeing a consistent pattern of inhibited, emotionally withdrawn behavior manifested by both of the following. That is, the child rarely or minimally seeks comfort when distressed, and rarely or minimally responds to comfort when distressed. And we want both of those to happen with children. In addition, so B, a persistent social and emotional disturbance characterized by at least two of the following. So minimal social and emotional responsiveness to others, limited positive affect, episodes of unexplained irritability, sadness, or fearfulness that are evident even during non-threatening interactions. And the child has experienced a pattern of extremes of insufficient care, as evidenced by social neglect or deprivation, repeated changes of primary caregivers, limiting opportunities to form stable attachments. So for example, a child who's moved from one place to another, or rearing in unusual settings, that severely limit opportunities to form selective attachments. For example, Romanian orphanages. Okay. Now let's talk about this in a more normal situation. Mary Ainsworth looked at this in the strange situation task. I've posted a video on this. And notice how the baby responds, how different babies respond to their mothers or caregivers in this situation. What Ainsworth says is that in this situation, most children exhibit secure attachments. They're responsive, caregivers are responsive to their children's needs, and the children respond well. Some, parents are distant or rejecting, this is avoidant, and fail to respond to their children's needs. And finally, ambivalent relationships are unpredictable in availability. So if we're thinking about attachment theory, we're saying children flourish in certain kinds of situations when there are limits, when there's warmth and communication, and when there's predictability. So often in foster care or in old orphanages, we didn't see these things. If you look at some of the care given during World War II, when children were sent out of London into the country, they often didn't get that kind of warmth and communication and consistency that we would like. What we really would like, you know, to as a consequence is to see some synchrony between parents and child. So in healthy relationships, we're seeing uh, synchronized gaze, affect, vocal patterns, and touch. We're seeing some synchrony in terms of heart rate, oxytocin, which is sort of a love hormone, cortisol, and some coordination in brain synchrony. We see some of the same kinds of things with romantic partners. We're seeing some of the same kinds of things with friends, but not with strangers. When we're looking at strangers, we tend to avert our eye contact when we're in close contact. Think about the last time you were on a bus or a train, for example. There's not really the synchrony that you might otherwise find. And when I'm saying synchrony, go out on campus or sit and, watch people in town and watch people as they're walking and talking. And you'll often see their legs moving in exactly the same pattern. So let's think about long-term consequences about this. Philip Shaver says we can expect similar kinds of things with adults. Those people who have positive thoughts about themselves and positive thoughts about others have secure relationships. They have good boundaries, trust, and support each other. As opposed to people who have a fear of abandonment, where they may not feel themselves in a positive or see themselves as positive, but they see their partners in a more positive way, or dismissive, avoidant, who see themselves as positive beings, but not their partner, and fearful avoidant, where they're having a hard time trusting anyone and see themselves as not so good. So this is where we want to end up. We want, with our children, to help them feel good about themselves and good about other people. And I'm going to stop here, and I'll see you in the next video.